In Ayurveda, there is a condition called Vatika Hridroga. That means the pumping power of the heart walls decreases or the strength is reduced.
They consulted 2 or 3 different cardiologists, did an angiogram, took medication for about 1 or 2 years, but there was no improvement at all.
It was only when 3 or 4 such factors were addressed together that this person experienced relief. Welcome to Marian Ayurveda. In this episode, we are discussing excessive heart palpitations that some people experience. We see many patients who, especially at night, suddenly experience a rapid increase in heart rate and then it calms down again. This causes severe anxiety and fear in them, making it difficult to sleep. We are going to think about what causes this and what the treatment is. I am Dr. Anumod Kakkassery from Marian Ayurveda, Thrissur. Now, with me today is Shobha. Shobha is from Kannur. Shobha had heart issues, right? Can you tell us what kind of difficulties you faced when you came here?
When I first came here, for the past 4 or 5 years, I had severe palpitations. At night, every hour while sleeping, I would wake up startled because of the palpitations. Then I consulted 2 or 3 different cardiologists, did an angiogram, and took medicines for about 1 or 2 years. Tablets, English medicines, but nothing improved. So that is how, after consulting with several doctors multiple times, I finally decided to make the call and came here. And that was when I started taking my medicines from this clinic.
So, how are you feeling now?
Now I am able to sleep well. Although the palpitations haven't completely gone away, they have reduced a lot. I am sleeping well. The joint pains and other aches I used to have mostly subsided, and I am feeling much better. I am still continuing with the medication.
Now, unlike before, I am able to lie down comfortably and sleep for hours at a stretch. That is the biggest achievement. There is probably another 10 to 20% improvement left, right?
Yes, that's about it.
With time, we are mainly working on improving the heart's pumping function. That has to gradually improve. It was mainly at night that we had difficulties.
Yes.
So what we tried was to address the fact that circulation decreases at night. So we increased the circulation a bit and boosted the heart's pumping at night. These are the kinds of things we did to improve circulation. Then there was some fluid retention, especially around the neck area. These are the things we tried to reduce. So usually when we increase the heart's pumping at night, because of the cold, the blood vessels would constrict. That's why at night, the heartbeat, or rather the heart rate, increases.
Exactly.
Like an increased heartbeat.
Then a pulse felt in the head.
That sensation of a pulse in the head and all those things were what disturbed your sleep, right? So what we did was just this. When we increased the pumping a bit more, even if it got cold at night, we still got good blood circulation, and as a result, the pulse decreased. All right then, thank you. So in this patient we just saw, their problem is actually a bit more severe. That is, experiencing this increased heartbeat every hour or so. Usually when patients come in, it's common for them to suddenly experience a rapid heartbeat, which often leads to intense fear and anxiety. In their case, this was happening every hour, even waking them up from sleep, so they were in a state where they couldn't sleep properly. This had been going on for 2 to 3 years. We know that, especially in these cases, even if you do an angiogram, you won't find any blockages. To understand this, Ayurveda describes a condition called Vatika Hridroga. That is, the pumping power of the heart walls gradually decreases, meaning the strength is reduced. Here, what we are still doing is giving medicines that increase the strength of the heart. In some cases, when we gave a person the tablets called Shilapala 101, there was an improvement right away. For some people, we increase the dosage of medicines that improve blood circulation. For some people, we enhance pumping by applying oils to the chest muscles. In this way, for each person's case, if we take this particular person's case, there was fluid retention and blockage in the areas where the carotid artery passes through the neck, and all these were problems. So there were some issues with the muscles in the neck. We corrected that. So when we addressed 3 or 4 such factors together, that's when this person experienced relief. Therefore, excessive heartbeat or weakness of the heart muscles can be very easily treated with Ayurvedic medicines. We know that it gets colder at night. When it gets colder, we know that if there is bleeding from the hands or somewhere and we apply ice, the bleeding will stop quickly. That means when it gets cold, the blood vessels constrict and the flow of blood is restricted. And that's why this kind of heart palpitations increase at night. Already the blood is flowing very feebly, and when the cold of the night sets in, it decreases even more. So when the blood circulation drops, we start to feel a pulse-like sensation or some kind of feeling in the head here. So in such cases, we increase the pumping here. If you ask why the pumping decreases, it's in people with hyperacidity that the pumping decreases. These muscles become weak. So for these individuals, not only did we increase the pumping, but we also administered medicines to reduce the hyperacidity they had. So through this kind of scientific treatment, Ayurveda has mentioned many medicines that can address the weakening of the heart muscles. There are many types of treatments, not just treatments for a single condition, but in various ways we can use these to increase the strength of the heart muscles. We can meet again in another episode. Thank you.